All right. So, maybe.
Good.
Yeah, good luck with that system.
Slide next
You
argument.
really have to know your slide.
Ah, there we go. Ah. All right. So, just a quick update on how we're doing with the case for quality.
I just realized I should have.
Program. A couple of things I wanted to share, right? Because we're moving along, things that are progressing. Some of the metrics you've already seen, some of those will be familiar. But also, I wanted to at least share some of the insights and perspectives of what's going on within CDRH. Because not everything's always 100% rosy, but what we're trying to do and see what we can do to improve on our end. So let's see. You've seen some of these before. Metrics on how many sites we've got. You'll see some of this coming up down the road. One of the things that we've been seeing a little bit more of, which is quite interesting, companies who've been participating, who've been enrolling, got multiple sites, and have seen benefit just from the program activities, have been enrolling other sites that are not medical device manufacturers. We've got one who, really saw enough of a benefit that they wanted to enroll a site that we don't even regulate, simply because it drove enough improvements that they want to serve and use that site to serve as the center of excellence for all the other ones that work in that same field. Okay, I'm not going to stop them. I don't think that's an issue on my end. It's also an additional data set should things come down the road that we want to take a look at. Pharmaceutical only sites. Again, none of the stuff that we've tailored here or done is a benefit to those pharma companies, but they've driven enough improvements with the ones for our medical device sites and the ones who have a combo product that they've enrolled just to our pharma sites. Okay, what are we going to do with that down the road? Not sure, but it's happening, and we'll have something to share as we move forward. Routine inspections, we've been waiving some of these. Again, one of the things I want to highlight for everybody in the room who got sites for participating, this is our commitment, is to waive those routine inspections. Doesn't always happen. Our system is slow sometimes in terms of how the updates happen and occur. If things are noticed or if you get a call, let us know. We'll work with the ORA investigation team and see what the purpose of the inspection is, if there's anything that's needed, and where possible, rearrange, because that's happened a couple of times and we've been able to work it through, and the ORA support has been very responsive. I know we got one very recently where I believe we got a call on Monday that there was going to be an inspection on a Wednesday at one of the sites that not only been inspected once, but had been already gone through. The site has actually gone through the pilot twice. They're on their second reappraisal. By Wednesday, by Tuesday, I think the investigator was able to readjust and correct the scheduling. So it's doable, we just need to hear about it, which is, I think, where I see the biggest gap as you'll see moving forward. We've had 4 for-cause inspections. Like I said beforehand, it was 3. For-cause inspections are still something that happens. If we see a signal, something we need to investigate, we will be on site. They are more focused. They try to target things. The results have been, fairly promising for the even for-cause investigations, and feedback from the investigators is actually very positive. So, just things to know. A couple of things that I'd like to highlight about the program that I know I wasn't necessarily expecting, but has been just interesting observations. Obviously, increased industry investment, but I'm not talking in terms of the cost for the actual appraisal for anything on that end. They're investing their own time. They're sending their own people to get trained. They're taking that and actually reapplying some of that back into their own internal capabilities, how they approach the strategic planning for the next year. It's been really an interesting perspective. They're really leveraging the program to try to drive what they can do, what they focus on, and how they improve things. Cross-training and collaboration, big one. Companies sending people who've been trained to kind of appraise each other, share best practices, learn from each other. maybe not necessarily in a direct competitor space, but it's been shared broadly across the board, which has been, I think, a phenomenal piece of. A better way to say it, I think, is a way to capture the fact that this is all about collaboration. You heard Suzanne talk about it a little bit earlier. I think that starts to highlight what you can really do with collaboration. Everybody's focused on safety, the patient experience. How do we do this and drive this better? And it doesn't matter. You're not competing on that piece of it. You're competing on everything else. You're just really focused on everybody moving to the next level, to really raise the ships across the board. It does drive the point back home that it's about the patients. Companies completely shifting and focusing on culture. Programs that aren't necessarily about addressing just 483 observations, compliance activities. One of the commitments that we made, I think early on from the start of the pilot, there will be issues. Companies will always have a problem. You're in the space of manufacturing that's always prone to having something go wrong. There's a lot of complexity in the system. What we said is, commit to us that you will come to us early, engage with us, we will work with you and collaborate to work on solutions versus our normal activities. That's actually happened. We've seen that done a couple of times, and it's worked out well. We've worked on our commitments. Companies still had to do what they did, and they did the right thing, so it resulted actually from learnings and feedback that was observed after the appraisals were done. Good practices, good behavior. It happens. Recalls happen. This is what we want to see in our commitment to engage. We've been trying to make sure we're meeting that and honoring our piece. And I think it's gone a little bit more smoothly. Metrics to date. Things we're seeing. The pilot is expanding. More people are engaged. We are getting more sites participating, more submissions coming in. We're starting to see the impact that's having on our ability to keep pace. So I wanted to highlight, this is not, I like the numbers. Now we're about like 73% of them are 5 days or less. They're taking a little bit longer, but we are seeing more of them get delayed or turned back to the company, and we hear about it way after the fact. We can address that because we can actually go back and figure out what's happening, what's the learning. One of the things that's really been successful about the program is we don't tell the reviewer that this is a must do. This is a change in how the information gets portrayed, and it's a value, but you always have the opportunity to pursue a little more if there is something that's missing. Oftentimes, we find that it's not there. What we do ask is if you've got to go back and change the approach, if you've got to take longer, if it gets converted, we'd like to hear about it so that we can learn, figure out what we can do and improve the process for the next time. Is this one that we can't even ever do through this type of appraisal pilot? We'd like to capture that. We don't always hear that. So I gotta put the letters in red. Please contact us if you guys are experiencing everything. We're trying to do some things on our end to improve things. But things that we've learned, some of the submissions are a little bit more complex and will require a consult. That tends to tip the scale in timing. Expanding product areas. One of the things that we found, as I mentioned, keeping pace. More pilots, more participants, more engagement, more branches. We can't keep the pace with getting to the branch ahead of time where the company's already submitted a submission. So it's a learning process. And then we've got to go and engage, train, and bring everybody up to speed. So it's part of that cycle. Communication and submission tracking. Sometimes these submissions come in, we're using our normal process. The system doesn't distinguish if it's case of quality submission versus not, at least in its current state. Blada just had to step out for a second, but Blada has come on board to help out with the team, and she's been phenomenal at actually convincing our system people to be able to track that. So we'll be changing that soon. Variability in the review focus, we're trying to work on that one as we start to make some of this information more visible to the review teams. So the other piece that we just started doing was the streamlined site transfers. We've got a couple that have come in. Site transfers, 180 days. We said, we think we've got enough capability, we can streamline this enough that we can target maybe a 10-day review. There was a lot of internal reaction to that number, just to highlight. But there was enough pause in that to think it may not be 10, but we're willing to try and just see where it comes out. But we think it's going to be a little bit higher than the 10 day. But let's see what happens. First site change came in 95 days. We learned a lot through that one. Nothing in the submission was inadequate. It was inappropriate. The template worked. This was all about just our internal process, and our communication was not on par. We really kind of had resource hits. There wasn't enough communication, and we couldn't get on top of it in time. Once we finally did, and kind of everything settled, the review actually went along fairly nicely. We got really good feedback on what we could have changed in the template submission to make that some of the issues they encountered move a lot faster and easier. So we implemented that. Moving forward, second site change we got in 13 days. Big difference. That was a lot closer to, I think, what we were trying to target. But it took a little bit of learning. And so I appreciate for the companies who have been courageous enough to take the jump to try and know that this is a process. It's systemic. We are going to try to improve things as we learn where the key issues are, and taking that leap. So for everybody here, go back and thank the companies also who took that initial leap moving forward. So things that we're trying to do from that standpoint is obviously we're going to start to improve our training internally on the pilot. We've got enough commitment. We've got actually enough stability in some of the activities and the templates to be able to train a bit better to that. Improving clarity and expectations, both internally and externally. A lot of the companies who've been engaged have been partnering with us and actually also tracking on their end where they're seeing things work well, where they're not, feeding that back, so that we can actually collaboratively align, is this really correct? And the first pass of that actually showed a lot of alignment, looking at it from two sides. So now we're trying to solidify, okay, these we know are going to fly through. These might require a little bit more effort, how we communicate that, or a different set of information than what's conveyed. We're increasing our engagement with the review teams now that we've got some extra help on hand. Again, the incoming submission tracking, we've got that moving forward. The other piece that we're trying to work on internally from a data standpoint is in sharing the results. The nice thing about the submission change, right? We did this not through forcing this to be the reviewers did in a faster time frame, not through cutting out necessary information, but by actually structuring the information, making it easier for the reviewer to get to, focusing it and taking out a lot of redundant information that wasn't necessary in the submission. So we're trying to make that data available to the review team now in that more visual structured format so they can actually take that and use that to leverage for next submissions. The better knowledge management around it, how we make our decision, what went into that decision. So, pilot metrics, some of you have already seen these. I won't dwell on these too much because we've got other things that we'd like to do, but these are some of the data points and some of the information that we've been receiving from companies, some of the things that we've been seeing from our internal data sets. Big highlight again, one of the reasons that we wanted to really focus on these modifications and these changes wasn't about, the incentive to industry. That was a huge bonus. It's the idea that we recognized early on in the pilot that sometimes just the length of time, what was happening for these submissions was resulting in a, I think, negative response, and not in a bad sense, just a resource sense. Companies didn't have the resource. Some decisions weren't put on the table. So once we started accelerating some of these things, and these metrics have been pretty impactful, you could see companies were making changes at a faster pace, something that wasn't happening beforehand. They were enabling their staff to really bring better and more ideas to the table. Results of that have been pretty good. And I think from our standpoint, the idea of, and I really, really like that one as a reviewer, he's been really engaged from the very beginning, been really supportive in trying to really move through some of these activities. But one of those reviews really resulted in a big impact, something that was directly measurable. So bringing that to their attention, showing them that they're not losing that capability, they're not losing that impact, and actually they're really driving it in a different fashion. It's a big deal for, I think, our internal messaging. So I'm going to move on a little bit, but I think these will be available, right? I got to sign that way thing. Okay, yeah. Excellent. What are we doing next? So let's take a little bit of pause here and see what's going on. Things that are ongoing work activities, and we'll see some of this a little later in the afternoon, but we are looking to really put together a proposal. How do we operationalize this? Take it from just a pilot stage to something that is not going away, something that is a little bit more stable, structured, effective, still maintaining a lot of the benefit of this collaboration. You heard a lot about that during the cybersecurity discussion. It makes a difference. It's what's driven a lot of the right focus. It's what's driven a lot of the trust and the attention. We've got work going right now to develop a charter for this program, what it may look like in an operational state, and thinking going on how do we establish that trusted operational structure? Something that is not just FDA, something that's not just industry, something that's relevant to payers, patients, other stakeholders in the ecosystem, bring them into the group, because that's another group that it has a distinct ownership of this. Current pilot is continuing. As you've seen, if people are not aware, we are still kind of enrolling sites as long as we've got the capacity to do it. While we work on the idea for operationalizing it, we are trying to improve the program. How do we expand the areas of focus than what we've looked at there? Some of the companies are doing this on their own. Next time that they do an appraisal, you'll hear a little bit more about it in the next presentation. They're rethinking what they want to focus on and what they look at. Improving data and information sharing. That's a big one. I think from not just this pilot's perspective, but maybe what we want to try to do to connect everything down the road. Improving the regulatory review capability for other submission types. I like to use that language versus regulatory benefits, which you'll hear a little later, because it's really what it's about. It's really what drove the initial changes. What we found out was this approach was having an impact to patients, simply because we could not get these things to the system fast enough. So what can we do? How do we change the way we're reviewing things to make it a little bit more effective, to bring in the right information for the review, allow these things to get through efficiently from our system, but still get, I think, the necessary look at safety and effectiveness that the reviewers are really focused on. Evaluating program applicability for manufacturers who are not necessarily in compliance. We put that boundary for the pilot. We didn't want to introduce that extra variable into here or sets of questions where we need to try to address that activity. But we've seen the capability to improve. We've seen manufacturers share what they've been able to do when they've got multiple sites and how do they drive improvement. So we know that there's a mechanism for applying this. But at the same time, we still want to be able to demonstrate and ensure that compliance portion. So how do we adjust the program? Because its current iteration may not be the way it works. What needs to be adjusted?
Yeah, thank you. Is it okay to ask a question, Cisco?
All the time.
Yes.
Microphone.
So I understand that as a voluntary program, it's a great one. You know, as any self-respecting company, we obviously are interested in, you know, serving patients first. So we are, you know, whether we are participating or not, we're gonna be, you know, it's quality culture built beyond compliance, right? So I know that CDR tried to do some of these, and they run into a roadblock a little bit. So if it become operationalized, how do you foresee it to overcome some of those potentially legal challenges if it's not a voluntary program?
So even in its operational state, I think it would still be a voluntary program. I think that's the vision for this, because not making it voluntary, making it mandatory, could be changes the dynamic entirely.
Yes, right.
So when we talk about making it operational, let's create a structure to do that. But similar to what we've done here, there are activities that we can modify, because those companies who are voluntarily participating, who are voluntarily sharing information, they've already reached the level where they just want to move beyond. They want to focus on the patient. They want to be able to enhance their capability to be competitive on the right things, we don't want to necessarily turn that from there to the mandatory standpoint. They're sharing. The voluntary options will still continue to work, and that's the way the operation program would operate. You're participating, you're on a voluntary basis. You're maintaining, sustaining, going on there, that continues. If you decide you don't want to continue to volunteer, you can always go back. We've got a path for that. So we're not changing that path, that's clear. So this is a situation where we're exchanging that traditional pathway for that transparency, for that collaboration, for that commitment.
Hey, Cisco, along those lines, obviously from an industry perspective, more people jump in. It's easy for us because as a company, it's one site, it's one location, it's dealing with CMMI, going through the assessment audit process. But it seems like the advantages so far of the program have really been that human touch, that interaction between the company and the FDA. The question would be, how scalable is the solution within FDA?
It's a good question. It's a really good question. And I don't know if I've got a full answer for that. I know that that human touch, that human interaction is what's been enabling us to at least keep the right focus. What we keep trying to do is, as much as we learn through that interaction, we try to systemize that internally, so that at least certain pieces of it won't ever involve that human interaction as we keep learning and adopting moving forward. I do know that for the first few years, there's going to be a lot of that touch point moving on. Can we sustain it? I don't know the answer to that because it's really going to involve the level of enrollment and engagement that we keep getting as we move forward. I know that the way we kind of envision being able to start scaling the program, it would be sustainable, but I never know what is happening from that standpoint and the level of engagement we're getting. One of the things I think that even the center has been trying to do across the board is to enable more of that engagement to happen across every activity in that program. It's a big focus point because it does make a difference. So I don't think it'll be a problem, but we'll be keeping an eye on it. The other piece that we're working on, and this is something.
No, I was just going to, Cisco, you mentioned the interagency communication. Can you explain a little bit about how regularly your group interacts with the various branches to make sure that there's communication within the agency about progress and the regulatory incentives and participating firms? You and I had a conversation a couple of months ago where ORA reached out to you and said, hey, it'd be nice to have a couple of these other companies. How does that work internally for the rest of the group?
So a couple of different ways, and this was part of our internal learning too. The bulk of the original companies were in a set of product areas that was very easy for us to engage collectively with. We had periodic meetings with the branches. We've got ongoing meetings with them. A lot of what I mentioned in terms of streamlining activities for the review came from their suggestions, from their ideas, their development and input. What I didn't anticipate was how quickly it would jump to other branches. So that was something that we're trying to now make sure we keep the same cadence. As we are getting more of these, we've already talked about with some of the base sites, maybe that level of touch point isn't the right one. We can act, for the ones who got more experience, we can move to a different model where it's a little bit more incoming system of communication that we can establish. So we'll be testing something like that out with the ones who have already been established, but it is something that we are now going to commit to doing a little bit more frequently, especially with the branches who are trying to be more attuned to the ones who are coming in who are new, who have not seen this yet. From an ORA standpoint, we are actually engaging a lot more with them now, especially as we were talking about this new program, because they're going to be a key contributor participant to that evaluation if we really go down that route. So they're more engaged. We do have now active communication with them, and we actually have a monthly meeting internally with our group, who's our liaison to ORA, so that we know what they're seeing, what they're not seeing, what we've got to communicate a little bit more effectively. One more thing, and then the last piece of that is we're trying to actually get some of our investigators into the trainings. trying to get them out and send them to get some of the CMI training, get them an opportunity to go participate in the appraisals. So we had interest and engagement there. So it's just a matter of will they be available or in timing? Because one thing we just heard was this first training aligns very close to the end of the fiscal year, and that's their busiest time. So whether or not they'll be able to get out, we'll see.
So maybe just along those lines, Cisco, on terms of the alignment between the reviewing and the inspecting parts of the organization, are you fairly also following along what CEDA has been doing in terms of program alignment?
Yeah.
They have already restructured themselves along the programs, and particularly the training. So they have a document now called ConOps. Okay, and are you going to be something like this, formalizing that relationship between this CDRH and the ORA?
Yeah, so the program alignment actually affected all the commodities that FDA has. So where there was the program alignment effort with, you're talking about with CEDAR and some of the engagements that they've put in, we've got our program alignment has already occurred from the medical device standpoint also. So when I mentioned that monthly touch points that we've got, it's with the group who actually works with the ORA aligned commodity to give them a heads up. Here's what's coming from a strategic priority standpoint. Here's what pilots are going to affect. Here's what's happening now. Here's what we're looking to change from a compliance guide activity, or what training we need to develop given the changes that we're modifying here. So that's happening, and that's where that responsibility falls.
Thank you.
Cisco, is there a plan to share the successful practices from all these CMI assessments so that all the companies can learn from it?
It's a really good question. I hadn't thought about that one. Maybe we could talk about that a little bit later.
Cisco, as you get broader within FDA and ORA, et cetera, do you see more opportunities where site visits or participating in events at companies' sites would be valuable for a broader population within FDA?
Yes, and we're hoping to try to do that. I know that the CMI Institute makes it available to us. It's a matter of, and a lot of the companies who are participating, especially ones who've gone through it already the first year, are very open to the additional participation and engagement. So we'd love to be able to continue that piece because it helps cement more of that.
Okay, I did not hear any questions
Okay.
Thanks. Okay, so when it comes to submissions and change notices, do firms in VIP jump ahead of all the other manufacturers?
No. So they're still in, and everybody, because the work is managed, when it comes in, the manager will assign it next in queue. Typically, the reviewers will take in with our first couple of days, try to get to it, understand what the review is, complexity of it, what they need to issue, if they need counsel to go from there. The advantage is within that same, which is why we went from 2-day commitment to 5-day window, is to give that time for that to happen. Because of the streamlining of the activities and the streamlining of the memo that goes out, they're just able to get through it even for that initial phase, which is really where the benefit is. But they still fall in line with everybody else.
Cisco, this is Robbie from Illumina. There's, this program has picked up a good deal of momentum given where we started. And so we should feel proud about the progress domestically. And now the program is expanding internationally. So the question is, do we envision any efforts to collaborate with regulators in other countries who might be interested in doing the same sort of thing?
Yes.
Because I also work with my regulatory counterparts and have teams in other countries, and just sharing some of what's going on here has already elicited a whole lot of interest on their parts. And I'm wondering if there's any kind of a coordinated effort we can think about to reach out to other regulators.
Yeah, I'm not sure necessarily about what the rule bounds are around the coordinated efforts for reaching out, but we do know that it's been a focus point. There's a lot of interest, both from companies who are in that global community and a few of the regulators have reached out. We have actually had active engagement with our MD-SAP team and part of the efforts, and we're trying to also, we've already set some to get trained. Some of them will be trained further. So there's alignment that we're trying to get to. We wanted, and we knew that was going to be a discussion point down the road. We wanted to be able to get through enough with the participants to have data to bring back to the table, right? Because when you're talking about that community, you have to have something to show for it. Say, it's not just an idea. Here's the kind of results we're talking about. There's something here that we can leverage. And then I hope that within that context, with any type of engagement, that they'll be able to think through that and bring that to the table.
I'm hoping that we could do something with the UK, actually, with the European Authority, because we're all facing the oncoming MDR and IVDR regulations. And so there'll be some benefit, I think, to adopting this kind of approach to see if we could get some alignment with them.
So, George Zach, Harvest Consulting, Robbie, I think it's a great question. And several of the manufacturers have actually said, hey, I don't think it's really reasonable to say to FDA, hey, FDA, can you go to MHRA and make this happen? Right? So, but there's definitely interest, and I think they're talking about trying to pull together some sort of consortium where they would approach the FDA of the different bodies that there's some really interesting things going on right now in Europe with MDR. And I think until just like last week, there was only one notified body that was MDR ready, right? And that was, now there's two, right? But that one was PSI, and we all know what's going on there geopolitically with Brexit, right? So it's not, and the other thing I think it's important to recognize here is, for a program like this to be successful, you need a SHRN and a Vicente in place in that regulatory body to be visionary, to say, hey, we're willing to provide regulatory modifications or benefits to get to that. And so I think there's an opportunity there. I absolutely agree. There's just so much to consider, particularly with Brexit and the number of notified bodies and MDR, and trying to find the right people in those organizations to get going there.
Yeah, I wasn't suggesting the FDA should reach out, but I'm thinking maybe we could have a discussion around how MDIC might be able to collaborate, or some branch that we could reach out. There's some activity going on already. So really, I appreciate your comments. You're right on.
I'll add to that, Robbie. This is Kim Kaplan from CMI Institute. So we've already polled the existing sites who are located internationally. We've contacted the sponsors from that site. We're looking to try to meet sometime in the next month or so to start the conversation about how we might do an approach like that. And I think if we have to choose between doing it fast and doing it right, we want to do it right.
Yep.
And we're not willing to relinquish either Vicente or
I think the last point I wanted to highlight, because it goes back to some of the work being done later in the afternoon, is there's a lot of other activities that we've recognized, right? Things that we've seen that are systemic barriers that we collectively work on and remove. The idea of the making Kappa cool, that's out there. So these are ongoing activities that we've also committed to driving and moving forward. And I think with that, I was going to open up the questions here. But if there's any more,
Like I said, the script's not shy.
Can you comment a little bit on the connectivity between the Case for Quality and the pre-cert program? Like trying to look at, is the company at a mature state, and when can we accept their changes, whether it's software or just regular device?
So there is a lot of, I think, goal alignment between pre-cert and what we're looking to do here. So I'm actively involved with helping build what's going on with the pre-cert program, what they're doing from an excellence appraisal standpoint. So they have a very distinct need in what they're trying to do and how they're trying to implement the modifications and the changes. So what we're doing right now is actually, through that engagement, we're learning from each other. They're taking some of the stuff we're learning from here and implementing it there. Some of the things that they're looking to drive, we're trying to figure out, okay, that looks like it would be good. How do we implement that here? we're focused on that standpoint, especially some of the things that they're trying to think through for changing, how they streamline certain types of submission activities. There may be a parallel that we can leverage. So eventually, I think there'll be enough that the activities will have some kind of convergence in some way, shape, or form. But they are trying to address a little bit of a different entity right now. The vision for pre-cert is that, once the model's been vetted, we can allow a lot of other types of approaches and methodologies to appraising to follow that model, which would align with a lot of what we're doing with CMI. So it's feasible. We're really cognizant of where the similarities are, also where the differences are. So that's why they're still a little bit distinct.
Cisco, thanks. Just a quick one. You mentioned the additional enrollments of a facility that had already been enrolled in the program, like a pharma site and a non-regulated site. I'm wondering, since VAP is kind of tailored towards the med device, was there a discussion about punting those towards maybe a more general CMI framework, like a CMI dev or something for those, or
so
why were they?
We didn't necessarily, because I think the way the company wanted to apply it, that was their choice, right? So there wasn't a need to punt it there when that interaction needs to happen. They've got the contact points that they want to go further and try something different. I think that they saw enough connection that was the model they wanted to focus on and use. So we didn't have to really kick it to a different model application or a more robust one or just a normal regular one.
Well, we're going to continue this conversation on VIP, so maybe I'll invite George and Kim to come up and I'll swap the decks here.